Greg Barnes, would you like to lead us in the Pledge of Allegiance?
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Good morning.
Good morning.
Welcome to Shawnee County Board of County Commissioners. It's June 18th, 2020. On my left is Commissioner Aaron Mays, who represents District 3, and on my right is Commissioner Kevin Cook, who represents District 2. I'm Bill Rippon, and I represent District 1. What's first on the agenda?
First item is item 3, consent agenda.
I move to approve.
Second.
Motion's been made by Commissioner Mays, seconded by Commissioner Cook. All in favor say aye. Those opposed, motion carries 3-0. Next item.
Item 4, new business, A, County Clerk number 1, consider all voucher payments.
Commissioners, this morning we have vouchers that total $1,828,080.60. The highlights out of the voucher report: the highest expenditure was under bridge projects for Bettis Asphalt and Construction, $637,455.44, which was for the Southeast 29th Street from I-470 KTAA to Southeast Croco Road, the bridge repair, or that road construction. Next highest was under holding accounts with the state of Kansas, $479,964.13. We have Capers contributions of $353,741.63. Health insurance premiums for our employees of $80,702.55. Under solid waste, we did have the Rearig Pacific Company, $30,750.40, which was refuse carts. Again, solid waste is an enterprise fund and not tax dollar supported. And I don't have any questions regarding the vouchers and would move for their approval.
I'll second. Motion's been made by Commissioner Cook, seconded by Commissioner Rippon. All in favor say aye. Those opposed, motion carries 3-0. Next item.
Item A2, consider correction orders.
I would move that we approve the correction orders.
Second.
Motion's been made by Commissioner Rippon, seconded by Commissioner Mays. All in favor say aye. Those opposed, motion carries 3-0. Next.
Item B, Stormont Vale Event Center number 1, consider approval of Spectra reopening plans for Stormont Vale Event Center on July 6, 2020.
Good morning, Commissioners. Kellen Seitz, Spectra Venue Management in the Stormont Vale Event Center. What we have for you today is we're seeking formal approval of our venue reopening plans, which we talked about in pretty good detail 2 weeks ago. This past week, we did meet with our advisory board to go over those specific venue reopening plans, as well as a number of new policies and procedure measures that we're putting into place for protection of our patrons and safety of our employees and all of our guests. One of the implementations that we talked about in pretty good detail during our advisory board meeting was the wearing of masks or face coverings for all patrons coming into every facility. It was recommended from the advisory board that our policy, which we had recommended, which was masks and face coverings for all patrons and employees and any third-party contracted service provider that was working in the facilities, wear a mask, down to patrons would not be required to wear masks for events under 500 persons. So that is what we are seeking approval of today.
Was this vetted through the health officer, the COVID recovery team, and looking at their recommendations for the facility as well?
This specific policy was not vetted through the health officer or the health department. We have provided our reopening plans with these policies and procedures as part of that. What we did as a company was create the venue reopening plan and all of our policies and sub-policy procedures. And our recommendation was masks use for all events and for every patron that comes into the building.
And is there anything specifically different about what you're doing in Shawnee County as opposed to what you're doing in Kansas City or New York or Chicago?
I wish I could say it was uniform. It's unfortunately very different in every region and every market of the country. So everybody's kind of taking a different unified, localized approach.
All right, thank you.
Commissioner Mays?
I'll just speak to that real quick since I serve on that board. Spectra has a national policy that they recommended. The board, after a relatively lengthy discussion, decided that, obviously we're different from New York, Chicago, LA, that we needed to form our own policy in some way. And ultimately, we decided if somebody's having a wedding in Heritage Hall, that it's probably, we probably don't need to enforce a mask rule on them if it's not necessary. So we decided basically events over 500, so that when there are people in tight proximity in Landon Arena, that's enforced then, so.
Thank you.
Good. All right. Do we need a motion to approve this?
I'll make a motion to approve it,
I'll second.
and then I don't know if there is any public comment on it, though.
Anyone else wish to speak on the matter? We have a motion made by Commissioner Cook, seconded by Commissioner Mays. All in favor, say aye. Those opposed, motion carries 3-0.
Thank you, Commissioner.
Next item.
Item C, appraiser, number 1, consider approval of request to reclassify 3 positions for GIS employees to position titles to accurately align with the industry norm for the current job duties and employee structure with no change to range or salary.
Good morning, Commissioner. Steve Bauman, County Appraiser. In keeping with our strategic planning, we're requesting reclassification of 3 GIS employees. This change will better align with the standard terminology for these current positions. Our mapping coordinator will be now our GIS, or our GIS coordinator will be now GIS manager. And then we have a GIS tech and a GIS analyst. We'll be adding a 1 to their title. And this is primarily for the purpose of creating the options for upward movement. Currently, there's no salary changes or range adjustments that we're asking for. We've taken this through the HR, worked with them, and assisted us in getting these positions retitled and a few description changes, duty changes.
Steve, if all we're doing is changing the title, but there's no budgetary impact, what do you see as the long term? Isn't it that they would then have the ability to be promoted into a higher position, which would have a budgetary impact?
That is correct. So the ones and the 2, or the GIS analyst 1 and the tech 1, we foresee in the future a tech and analyst 2. So there's that upward mobility. As far as the GIS coordinator to GIS manager position, there's no upward movement in that. That's our top position.
So by doing this, you're creating the ability for your GIS mappers to have a higher salary, which would increase the budget for the appraiser's office
At some point in the future,
at some point in the future. Okay.
potentially. And that's going to be an education and experience requirement met in those job descriptions that we don't have yet. I mean, we've got the job descriptions in our own office, but we do not have them as part of the HR files. So we'll be asking for those 2 positions to be created at such point where we find it important.
Our GIS is a critical part of the county's infrastructure, from the mapping. Really, every department relies on GIS to some degree. If the concern is that the employees are maybe under market in their salary, why not just change the salary? This seems to be a roundabout way to just increase salary. And if they're underpaid for market, why don't we just readdress for what the market is? And I'm not trying to be difficult, but let's
Right.
call it for what it is.
Yes, and the answer to that is no, not necessarily right now. I will tell you the next item on the agenda is replacing our GIS analyst position. He left for another location, much higher salary, not too far away from here. So we are competing for these jobs. At this point, if we need to ask you to increase those salaries when we're looking for the new employee, I will definitely be back here to specifically do that. And at that point, we can enact the two. But as of right now, we're planning for the future more so than trying to go around the salary requirement.
Okay. Thank you for answering the questions.
But these titles align with the industry standards, is that what you're saying?
That's correct. And I've got Lee Allen here, our GIS manager, to help answer any questions if it gets too technical, because he's the guy, so.
Like, Mr. Chairman?
Sure.
Just, and again, our GIS is a critical part of our infrastructure, and I want to make sure that we are able to retain the people that we have. We have an excellent GIS staff currently, and I just want to make sure that we're able to keep the staff that we have, and not, and private industry is always going to be able to outbid government, but
Right.
keeping the employees here that we can.
Well, we lost one to government also. So, and we will be having our tech position retire within the year. I don't know if we have a specific date yet, but it's coming. So we will be looking to fill that position as well. So in preparation for these moves, in preparation for any future salary studies, we wanted to make sure that our titles were in alignment with that.
And this is, again, the salary is always an issue. I mean, this is the same issue that we have with Department of Corrections in retention of our employees, where other governmental entities will outbid us and we'll have employees leave. And sometimes they come back because it wasn't exactly what they thought it was. But trying to keep our employees' retention is a critical part.
Well, I'm hoping that's the case with our guy that just left. So he's a good employee and great asset to Shawnee County, so.
I don't have any other questions. I'll move to support the recommendation.
I'll second. Motion's been made by Commissioner Cook, seconded by Commissioner Rippon. All in favor, say aye. Those opposed, motion carries 3-0. Next item.
Item C2, consider approval of request to post and fill a GIS Analyst 1 position at a minimum starting salary, including benefits of $57,594.80 with funding from the department budget.
Commissioners, this is to fill the position that just left into a GIS Analyst 1 position now. So I'd be happy to answer any questions.
I don't have
Any questions? I'll move for approval.
Second.
Motion's been made by Commissioner Rippon, seconded by Commissioner Mays. All in favor, say aye. Those opposed, motion carries 3-0. Thank you, Steve.
Thank you.
Next item.
Item D, Parks and Recreation. Number 1, consider authorization and execution of contract C225-2020 with Meredith Melrath to provide sign language services for youth sports participants at a cost of $40 per hour, 2-hour minimum, and .575 per mile with funding from the Park Services Division operating budget.
Good morning, Commissioners. Randy Luby, Parks and Recreation. Before you is an independent contractor agreement services for a sign language interpreter. We have a person who's requested this, playing youth baseball, I believe. It meets our outreach and diverse underserved population policy, as well as our CAPRA accreditation policy. I think it's a pretty cool service that we do, and we try to accommodate as many people as we can with this. Be glad to answer any questions you may have.
How many kids will this serve? You know?
Right now, we just, I believe, had the request for one, but with the contract in place, if others are out there, we can accommodate them.
Okay. Any questions? I'll move for approval.
Second.
Motion's been made by Commissioner Rippon, seconded by Commissioner Mays. All in favor, say aye. Those opposed, motion carries 3-0. Thank you, Randy.
Thank you.
Next item.
Item E, County Councilor. Number 1, consider authorization and execution of contract C226-2020 with Railroad Heritage, Inc. for the donation of the Great Overland Station, the underlying 10.9 acres of land, personal property, and to include abiding by the terms and conditions of the National Register of Historic Places and the Kansas Register of Historic Places, and to lease office space to RHI for 4 years for $1 per year.
Good morning, Commissioners. Jonathan Berzon, Assistant County Counselor. In addition to what Cindy read, I want to point out one other thing that Commissioner Cook brought to our attention yesterday. When the property was deeded from the UP Railroad to Railroad Heritage, Inc., there was a condition in that deed that's going to run with the land that's going to apply to us, and that condition is that it can only be used as a railroad museum and activity center and not for commercial purposes. So he just wanted to make sure that we're aware of that going in. Be happy to answer any other questions about the contract, and I believe Bob St. John from the Railroad Heritage, Inc. is here if you have any questions about the property.
Yes.
In preparation for this meeting, I had asked the counselor's office to go back and grab the original contracts from Union Pacific to Railroad Heritage, Inc., and prior to that, Topeka Railroad Days Incorporated. Just a little bit of the history to it. And the original deed, this has a reversionary clause that if the property is ever not used for a public purpose, it reverts back to the Union Pacific. What is a public purpose?
Not a commercial purpose. Not a for-profit purpose. So open to the public would be my interpretation of that.
So we would not be able to sell the property. It would go back to Union Pacific.
Or another public purpose, like
Right.
maybe the National Park Service or something like that.
Because originally, if it was to revert back to Railroad Heritage Incorporated, that entity may not be in existence 30, 40, or 50 years from now.
Correct,
Most likely, Union Pacific will still be in existence.
correct.
So it would go back to the original. So whatever Railroad Heritage Incorporated has, we're stepping into their shoes.
That's correct.
So this would prohibit us from being able to sell the property. We could not bring in a private management company for a for-profit business to run it, right?
Correct.
We
But-
couldn't develop it as a commercial entity such as a Navy pier or some sort of a private activity.
Correct.
And so we're somewhat limited in what we're able to do, correct?
Yes, that's correct.
Okay, and then additionally, there's this provision in their contract in the donative quitclaim deed and from 1998 that says the property shall only, or that the property shall be used only as a railroad museum and an activity center for the general public in compliance with all terms, conditions imposed by the state of Kansas in connection with the depot being on the Kansas Historic List, and shall not be used for any commercial purpose. With that language, if we wanted to lease out a space to a McDonald's, wouldn't that then throw us potentially in violation of that donative quitclaim deed?
Potentially, yeah. I mean, it would depend on the facts and circumstances and if UP wanted to raise that issue at the time.
And I'm curious as to how we're able to, I mean, if we are going to, again, I think is we're going to look at our operations, or how we're going to run weddings, wouldn't that be a potentially, I mean, conflict with it? or-
Well, on that point, it's my understanding that Railroad Heritage has already been having weddings and events like that and charging a fee for that and putting the money back into the facility. So I think that probably falls under the activity center for the general public part of it.
All right. And then we couldn't clear out the entire building and use it for county offices.
As long as you have a railroad museum and activity center for the general public, I think there's probably some leeway for other spaces that aren't open to the public already to be used for that kind of thing.
Is there any definition of what a railroad museum and
No.
activity center is?
Neither of those terms is defined.
Okay. So that would be a potential point of discussion down the road.
Could be.
We've had this problem come up in other instances such as the Gage Park. And there's been a lot of litigation over Gage Park over the last 100-plus years over what was donated to the city and whether or not they were in compliance. So we do have a bit of history in our community for that, right?
That's correct.
And at one point, didn't the Gage family even look at trying to have the Gage Park revert back to them because they deemed, or they argued that the city of Topeka was not in compliance with the
Yeah,
original?
I think so.
And so I think that it's important that we recognize maybe what we're getting. I'm just publicly, I'm very supportive of this and very supportive of the partnership and being able to assume the operations of the railroad, the Great Overland Station. But I just want to make sure we know what we're
Okay.
getting in ourselves into. And I think that, whatever we do, we're binding future commissioners and the Shawnee County taxpayers to for an indefinite period of time. And so I just want to make sure we know what we're getting ourselves into before we do it.
I had asked for a different type of deed than a quitclaim deed. Are we able to do that?
Yes, we're going to get a warranty deed.
Thank you very much. And I also asked the contract also contain contents of the building and
Yes.
and mention the other buildings.
Yep.
Because it's more than one building.
Yes.
If we're going to be asking for a warranty deed, though, wouldn't we need to have that developed as well as the listing of all of the property that we're acquiring?
It's listed, I believe, isn't it?
The list of the personal property hasn't been done yet, but the legal description is what's attached.
Right.
So we're just going to put that legal description on a warranty deed.
Okay.
And then we're going to have a title search done and title insurance and all that stuff.
But that hasn't been done yet?
That hasn't been done yet.
How long would that take to do?
A couple weeks, probably.
Okay. Commissioners, I know that there is a bit of time of the essence. We've had some executive session discussion on this acquisition of this property, and I understand that, again, time is of the essence, but would it behoove us to possibly think about getting all of our ducks in a row with the warranty deed before we take action? I know that we also had received an email from the chairperson of the advisory board for Parks and Recreation asking that it maybe be vetted through the Parks and Rec Advisory Board as well as the contract with the city of Topeka under park consolidation laid out, that any acquisition of parklands would be vetted through the Parks and Rec Advisory Board before it's brought to the county commission.
Would this be viewed as parkland?
I don't know what else that is part of our, but that's been our part of our discussion, is that is our ongoing view towards that being part of the riverfront park. I don't know what other use.
Yeah, I'm just saying.
But, yeah, I think that's
It's real estate.
that's my belief, is that we're acquiring this for parkland. It's gonna be operated under Parks and Recreation.
Could we approve it pending on successfully
And maybe
generating a new deed?
looking to our legal counsel, under the City of Topeka, Shawnee County consolidation, there was a specific part of that contract that outlined the county and the Shawnee County Parks and Recreation Department shall consult with the advisory board regarding major proposals and propositions for the construction, reconstruction, improvements of public parks, recreational facilities in the city and county, including acquisition of lands for park purposes, the acquisition of major recreational equipment and facilities, and the initiation of new programs in the recreational system. And all consideration, such proposals and propositions shall be taken under consideration by the advisory board. The advisory board shall make reports and recommendations to the Shawnee County Parks and Recreation Director and the county on all matters referred to it. It may make further reports and recommendations to the Shawnee County Parks and Recreation Director or county as the advisory board deems advisable. And so I think that if we're going to be in compliance with our contract with the city of Topeka, and the last thing we want to do is to be in breach. Again, I'm supportive of this. I think this would be a great asset to Shawnee County. This is a great addition to the Riverfront Park, but I think we've got to do things in the right order. And we have a due diligence as commissioners to make sure we've done a full investigation and make sure that we know, as the commissioners, what we're getting ourselves into. And if we can have a warranty deed that clears up this as to what we're inheriting, I think we have a duty to do so.
Mr. Mays?
Well, I don't know. I'm supportive of this acquisition, but I certainly see your point that, you know, if I want to do this, but I do want to make sure that we do it correctly, and that we're not, you know, stepping on any landmines.
Jonathan, how fast could we turn this around? You say 3 weeks? or-
Couple weeks probably to get a
2
title
weeks.
report done and then get the warranty deed.
Ms. Roberts is in the audience. We could ask her if they can call a special meeting of the Parks and Rec Advisory Board to meet. I know that their next meeting is 3 weeks from now, but on something like this, I'm sure that they could.
2 weeks? She says 2 weeks.
2 weeks. I think that, again,
Okay.
make sure we do our due diligence.
All right. So you want to defer this till,
2 weeks from now is
Flip.
June the 29th? No, I'm sorry, July the
3rd,
2nd.
2nd?
I'll
You want to make a motion?
I'll make a motion to defer action on this item till July 2nd, so that we can have a warranty deed prepared and have it vetted through the Parks and Rec Advisory Board to be represented to the County Commission.
I'll second.
Motion's been made by Commissioner Cook, seconded by Commissioner Mays. All in favor, say aye. Those opposed, motion carries. Next.
Thank you,
Next item.
Item F, Health Department, number 1, consider authorization and execution of contract C-227-2020 with Biodefense Network to conduct contract tracing for Shawnee County COVID-19 cases at a cost not to exceed $10,000 per month, with funding from the departmental budget and reserve funds, and request to waive the purchasing policy due to the scarcity of the available providers for the service and the urgency of onboarding staff, assistance for staff.
Good morning, Commissioners. Linda Oakes from the Health Department. I am requesting approval of this agreement today. This is kind of a brave new world for us. We have never outsourced this kind of work before, but we're at the point where we really do need the help. We have all of our staff doing the work right now, the contact tracing. We have many volunteers also helping, and some of them have been with us since the beginning, so they really are committed volunteers. But I desperately need my staff to get back to their other jobs, and so we can start doing immunizations again and some of the other services that we provide. This company, Biodefense Network, is well respected in the emergency management field, and that is where I was told about them. They are out of St. Louis, and the people doing the actual contact tracing will be upperclassmen or recent graduates of public health, nursing, or allied health collegiate programs from St. Louis University and surrounding educational institutions. They'll be supervised by a professor of nursing. I have spoken with all those folks on Zoom meetings, and I'm confident in their ability to do this work. We will continue to direct the work. Carrie Delfs and Diana Yates will continue to do their work they're doing by getting the cases from the state system, cleaning up the data, and then giving it to them, much like they're pushing out the cases right now to our staff and to volunteers. So it's really just giving our frontline staff an opportunity to take some time off, to go back to their regular jobs, and give us more capacity to do this work. This work is really the only thing we have in our arsenal to fight this virus right now. Doing contact tracing, finding out from people who have the virus, who are your close contacts, and having those folks in quarantine stops the transmission of the virus. And so when we get cases of people who are already in quarantine and they have no other contacts, we've stopped that transmission. So that's our goal, and that's going to continue to be our goal until we have a vaccine or there is herd immunity, which we are a very long ways off from that. So I really see this as a good solution. It is new. We're trying new things. We're trying to be creative to get this work done, and I'd be happy to answer any questions.
Thank you, Mr. Chairman. Did this go through a bidding process? Was there public notice? Did we reach out? Do we have phone bids? I mean, we have purchasing policies that we follow in Shawnee County.
We are asking to waive the purchasing policy with this particular agreement because there aren't very many companies doing this. I did talk to 3 companies, and so I felt like this was the most qualified, and we really need to get going. So I felt like the urgency of getting it going, and I did discuss this with Betty Greiner, our finance officer, and she agreed.
And Betty, if step up just for a moment. Again, when we're talking about an expenditure of $10,000 or up to $10,000 and waiving the purchasing policies, what steps we go through?
Well, yeah, this is such a specialized thing right now that it's really hard to go out for proposal, and also the time that it would take to go out for a proposal. We have talked about it extensively, and I think we want to make sure that if we, do go out and contract for this, that we are going to the right people. So for all of those reasons, the timeliness, the reputation of the company, the specialty that they provide, for all of those reasons, I believe that this would be a time to waive that purchasing policy. As she said, she has talked to 3 different companies, so really has really kept the spirit of the purchasing policy, and that we just don't, go with the first one or the, but, so I think she's had verbal conversations with them. And I think that also gives us a comfort level. But I do think in this case that waiving it would be appropriate.
Betty, would this be an expense that we could cover with the CARES Act?
Well, we will certainly check to make sure. We're still getting information on whatever is eligible, but we've got several different grants going. So I really think that this would fit into one of those that we could, whether it's by reimbursement or whatever. I think we could cover these costs in one of those grants.
Mr. Mays?
I guess this would be more for Linda, but will this decrease the amount of overtime hours that that our employees are using up?
I'm certainly hopeful that it will. That's my plan, is it will. And I will say on this company, this was the least expensive of the companies I looked at, too. It was the most reasonable cost.
As we open things up, or doesn't it become more difficult to track people? I mean, as people, obviously, if they're out and about, they're going to meet more people and come in contact with more people.
Sure, it's going to be more difficult, but it's going to be more important that we keep trying. Because, again, the more we can get folks to stay in quarantine if they have been exposed, then they're not, and if they become ill, they're not passing that virus on to people. You are contagious 2 days before you are symptomatic. So that 48 hours before you even know you're sick, you're passing the virus around. So that is why quarantine is so important. So yes, it will be more difficult, but having this kind of help with the work will really give us that assistance, I think.
What are the state statutes now on quarantine? Is there something in there now that they don't have to really work with us if they don't want to, or am I interpreting that right, or?
Well, so the state statutes on quarantine have not changed. There were some changes to the contact tracing legislation. Honestly, County Counselor's Office, Ashley Beeger, looked through that carefully. She crafted this agreement based on that. I really want to thank her for all the hours she put into that. We're still waiting for interpretation on that legislation. KDHE is going to be coming out with guidelines for us. So we are following it the best we can right now until we get those guidelines. Those are due August the 1st. So we'll be watching for those. And then the company will follow those guidelines as they are given out by KDHE. We've had those discussions.
Okay, when we quarantine somebody, now will this company, will they be working with the quarantine people? Is that who they're working with, or is it just tracking people who have been exposed, or?
Right now, they are only going to be calling the people who have tested positive and getting the information. We are still working with the quarantine folks. We had a survey, you might remember the local health department Academy of Science agreement I brought several weeks ago. That was giving us that survey that people were able to fill out and bring back. Well, that system has gone down, so we're waiting for a new system through that. So right now, we're kind of in between. But we're using email as our way of keeping in touch with people who are in quarantine, unless they need the calls, and then we can do that too.
How large a staff are they going to be bringing in?
They're going to provide a certain amount of hours. And so, and I believe, and I don't have it in here, I believe it's up to 200 hours a month. And so they're going to be using part-time staff, students, and so they're going to determine how many people. So the cost is up to $10,000 a month. So,
Okay. Yes.
Commissioner, if I may. Linda, there's a lot of concern about privacy, violations of privacy, government tracking you, government Big Brother looking over your shoulder, whether or not this is going to be, my information is going to be sold or distributed, or whether or not I'm going to suddenly wind up with people knowing my personal information. And so if we can address that, just walk through with me. If I tested positive for COVID today, and I knew that my symptoms were started on Wednesday, you're going to go back to asking me, Commissioner, who have you had contact with since Monday? Right?
yes.
Or
that's-
Sunday.
Right.
And so if we use Sunday as the start of the week, and so you're going to say, who all have you had contact with since Sunday? Am I then going to say, I've had contact with these 23 people? The tracing company is then going to contact those 23 people? Or what's going to happen next? Walk
Okay,
me through
so
this.
let me walk through the whole process. So if you test positive today, our nurses right now, but then it will be the company, will call you after you already know you've tested positive and ask you some questions about who you've been around the last 14 days so we can figure out where you contracted the illness. So we do that first. And then we find out who you've been around the last 48 hours to see who might have been exposed. So those are the people that we analyze, and we're going to continue to do this work. We're going to analyze who is a close contact. Now, if it's a household contact, they're close contacts. So those people are quarantined for at least 14 days, maybe longer if they stay in the household with the infected person, because that quarantine doesn't start until that infected person is well. So that's quite a bit longer, because you're exposed every day if you're living with a person who has the virus. So if it's a non-household contact, we're going to continue to contact those folks. But we will do the analysis to decide if it truly is a close contact or not. There's certain, you have to be within 6 feet for at least 10 minutes, and we look at, it's a much different situation if you pass someone at a store. That's not a close contact. It doesn't mean you can't get the virus that way, but it's a lot less likely. Or if you're at work shoulder to shoulder with someone, for a period of time. So without proper PPE, and I mean medical PPE, not just masks. So that's what we're analyzing. We're going to continue to do that work, that we're going to analyze those contacts.
So are you going to then, is this company then calling me if I've had contact with somebody within the last 14 days of them being tested positive?
No. No. The last 14 days, or we're just trying to see where you contracted the virus. We don't call those folks. If we can figure out where you got it, we already know those people. We're going to call the people that you've in contact with within 48 hours prior to becoming symptomatic.
Okay.
We will continue to contact those people at this time.
So only the people within the last 48 hours would be contacted?
Correct. Yes.
And if you call me up, again, if I test positive, and you say, who have you had contact with in the last 14 days? And I say, I'm not telling you nothing. Am I going to be locked up and taken to jail?
No, we are not. We can't force people, especially with the new legislation, to give us information, but we're pretty good, and we're pretty nice to people. I mean, we're just good people. So we're pretty good at getting people to talk to us, and we help people understand that we're not trying to spy on you or try to get into your personal life. We're trying to figure out who else might get sick from your contact, and most people want to help their friends and family. The possibility they could get sick, they want to help those people. So most of the time, people are very cooperative with us because we're doing it for the good of the community and them.
Data mining is always a big concern. Companies buy up people's information all the time for advertisements. Are we sure that this company is not going to be selling my information to a third-party vendor? And I'm suddenly going to wind up with advertisements on masks and face shields and ventilators.
Well, I can't guarantee that won't happen, but this company is not going to sell your information. All the information is going to stay within our system, only we are going to access the state system. So there's several protections in place to make sure that does not happen. They all sign HIPAA agreements. They sign the business associate agreement, so they are responsible for keeping those HIPAA rules in place, just as much as we are. And remember, these are health professionals or students who are going to be, so they're under those same requirements as part of their schooling, too.
What kind of a success rate do you have in actually finding where they contracted the virus?
Well, Dr. Pizzino is going to have that slide today. When he shows the slide where it says how many people had an unknown source, because we talk every time we meet about how important that is, that we know where your source of infection is. So when that number goes up, that means we have more community spread and we don't know where it all is. So we're watching that, but I'm going to let him talk about it because he's got the slide and I don't remember the exact number.
And how long do we keep tracking people? I mean, when does it end?
It ends when we have a vaccine or we are convinced that this disease is no longer spreading in the community. We've never done this before, so it's a good question.
Commissioner,
Yes.
how long is this contract for?
I did it for a year. We do have a 30-day option to back out of the contract. Also, they only get paid when we send them work. So if we're not sending them work, they won't get paid.
So we're obligating the county up to $100,000,
Correct.
or, I'm sorry,
120.
$120,000.
Yes, the 10,000 a month. But I don't know, it's not going to cost that much, especially the first few months, because we're not going to send, we're going to start slowly, and we're going to train them, so it will be a slow uptake. So the first few months won't be that much.
And how much does our overtime cost us with using our own employees?
I don't have that figure, I'm sorry, I don't have it with me. This is less than hiring people, I do know that. $20 an hour, I can't hire people for that.
But the health department, I mean, haven't you seen an increase in your costs since the
Yes.
COVID?
Yes,
And it's been a pretty big increase, hasn't it?
yes. I don't have the exact figure, but I do know it has been a pretty big increase. And I have our accounting staff working on that for me right now.
As we consistently hear over and over again that our staff is completely tapped out, that they're working 7 days a week, long hours, and they're not doing their regular jobs. I mean, the health department, these folks were working full-time prior to COVID, doing vaccinations and administering the WIC program, the in-home visits for new mothers. I mean, there's all sorts of things that they need to be doing that's not contact tracing, and I think it's, it's an expense that I think we're likely to get reimbursed for, and I think it's something that we probably need to do to take the burden off of our staff that has other jobs to do, and so with that, I'd move to approve.
I'll second, but I would ask, Mr. Chairman, if there is any public comment.
Do we have any public comment? Yes.
I just have a couple of questions.
Your name?
I'm sorry, Tammy Hunt. As I'm hearing her talk about this, contact tracing is something that does not sit well with me. Just first and foremost, I'm just telling you, I think it's not necessary. And I keep hearing the stating of we're nowhere close to herd immunity, which we're not going to get to herd immunity if we keep stepping in front of people who are going to be the illness is not going to affect them a lot. We would never have herd immunity. We're waiting on a very iffy vaccine. And in the meantime, people are feeling pretty pressed upon to give out contact tracing information, and you're asking to spend $120,000 on something that people are going to get the virus. We still have the flu. They have vaccines, but we still have that, and nobody traces that. I don't think this is a necessary expense, because we do need to have people getting the virus. I've been out there all the time, haven't got it. I mean, possibly might have had it in February before we really knew it was here. But my family and I we get outside every day. We get out and I go to the store and I do all these things. I don't wear a mask. I don't wear wear gloves. And I certainly would not cooperate if someone asked me where I'd been in the past 14 days, and to have my family quarantined for a month and a half or however long she's suggesting is not okay. That's just food for thought. I just don't think this is a good expense for our community. That's a lot of money.
Thank you.
Excuse me, Betty Griner, Director of Administrative Services. Just got a text that the overtime for last pay period was $7,500 for the Health Department. And that was just for one pay period. We have 2 pay periods a month. The one before that was $5,500. So for a month period of time, we had $13,000 of overtime.
Mr. Chairman, I see
Yes.
we have another public comment.
Okay, thank you.
Thank you. Okay, so my day job is, I run a national nursing, Terry Roberts, sorry. I run a national nursing association that is headquartered in Topeka, Kansas. So every day, I am immersed in COVID-19 and what nurses need in the country. I currently serve, I was on a 3-hour call to the American Nurses Association Board of Directors meeting because I represent all the specialty nursing associations, all 37 of them, to the ANA Board of Directors. I'm the OA, what we call the OA liaison for 2 more days. So I have to say that when I saw this, I am in full support of contact tracing. You look at the countries that have been successful in eradicating and calming it down, and in contact tracing clearly is their modus operandi. South Korea did it really well because they're full of apps. So they had an app so they could do it rapidly. Apps are run on cell phone numbers. So New Zealand, same thing. Very excellent contract tracing. I totally support this, and I can't imagine that our CARES funding that is coming to the state isn't going to be able to be reimbursed for this kind of activity. This is clearly COVID prevention and eradication focused. So I understand herd immunity, okay? But we're in a pandemic, okay? Pandemic is different. I served on the pandemic preparation committee for the state of Kansas back in 1999, okay? I know that we have Cipro sitting in bunkers in the state, okay? We are in unprecedented territory, and I don't know that there's anyone in this room that was here in 1919 to 1920 when we had the last pandemic. Half the world's population was lost, okay? Half. People don't understand how difficult this is. This is a difficult number to understand, but it is significant, and contact tracing is, I believe, an essential component to us trying to calm this down. Thank you.
Terry?
Yes, sir.
Have the hospitals been overwhelmed ever during this?
Not ours.
Not all. This-
But we're having problems, so glad you gave me the platform here.
Okay.
We're good on PPE, okay?
Okay.
We're not good on testing, okay? And here's the other thing. For 23 years, I was the executive director for the Kansas State Nurses Association. So I went to the Kansas legislature in front of your father many times and testified on behalf of the nurses in the state. So I'm well networked. Here's what I found out. Well networked, because they call me and email me, okay? I had a nurse anesthetist yesterday email me, Terry, I can't get the proper mask, what we call a PAPS, which is the right one. And I said, okay, you need to put it in writing. Here's the 3M website. You need to ask for this to be ordered for you so that you're protected when you're giving anesthesia. Second thing is the testing reagents. We're 6 months in, and we still have inadequate testing. I got a report from Shawnee Mission a couple weeks ago. Oh, I'll tell you the one in Broward Health. Broward Health my president's from Broward Health down in Florida. They took the cruise people. I said to him, are you having trouble with testing? He goes, yes, Terry. We had 400 tests last month per week. We have 40 tests per week this month, which we call the fast tests, okay? Ones that you can turn around in 2 hours, okay? Well, if you've got a patient in labor and delivery and you've got a patient that's a trauma patient that needs to go to the OR, you need the fast turnaround. The doctors in the Kansas City area are very frustrated with this because they have a patient that's admitted and they go, well, we're not going to know for 10 or 12 hours whether or not, because we're going to have to go with the long test. So I am concerned about the availability of testing, and you've heard our own governor say, well, we're like low man on the totem pole for getting things, partially because we're doing so well, and we are doing well.
What's the percentage rate of survival of someone who gets this disease or this virus?
You know, I can't speak to that, but I have lots of information, and if you want me to send that to you, I'll be more than happy to do
I know
that.
it's over almost 99% of the people who get this survive.
We don't even know
That-
because our testing has been inadequate, so we don't know the
It's-
population.
It's probably
like
better than that then.
It may be. I don't know.
But that's not, it's hard to,
That's apples to apples and oranges to
That's
oranges.
pretty hard to relate to the Spanish flu. That.
Well, we didn't have the technology that we had
That's
then, and
right.
we didn't have the communication. We certainly didn't
right.
have the social media.
We didn't have the medical.
No, technology.
So it's hard to compare it to that, but you were, so, anyway.
I do, and I'm committed to, serving our community. And I'll tell you, Craig Barnes can say, Terry Roberts sends me emails about things. The first week of the declaration, okay, I sent an email to Norman and to the guy running the emergency center here in Kansas, okay? Because I wanted to make sure they knew that, in my opinion, and I represent nurses, that getting our PPE supply to the front line was essential, or we were going to have clusters of healthcare workers that were gone for 14 days. Thank you.
Thank you.
Sonny Scroggins. I thought this was a good opportunity to really to talk about the need to wear masks. I am in support of that. I came up to talk about Juneteenth with the Elmer Jackson grave. And I got something for Mr. Cook, whom I met.
Sonny, I've got mine right here.
Yeah, this is special.
Okay, thank you.
I see that you got yours. You being funny again? It's all right. I want to take a knee, too, for Juneteenth. And the Elmer Jackson Bridge, and the need to stop the pain. Mr. Cook, when I first met him, he talked about racial profiling in these people. And he had the statistics to back it up. And I passed that along to the black leadership here and speak. You remember that, don't you, Mr. Cook? Yeah. Anyway, Juneteenth is important, and I hope everybody gets the opportunity to visit and learn more about all of us, because we ain't going nowhere. Thank you.
Thanks, Son. All right. Anyone else wish to speak? Linda? You have more? All right. Is there a
Motion made by Mays and second by Cook, so.
Okay, I didn't know we were that far along. Motion's been made by Commissioner Mays, seconded by Commissioner Cook. All in favor, say aye. Those opposed, motion carries 3-0. Next item.
Thank you, Commissioner.
Thank you, Linda.
Item G, Administrative Services, number 1, consider approval of a request for the Board of County Commissioners to establish a Shawnee County Spark Committee to evaluate the needs of county entities and other entities within the county for the CARES Act funds for costs related to COVID-19.
Good morning. Betty Greiner, Director of Administrative Services. I would like to start this discussion with a little overview for you and for the public. The slides I'm going to show come from the state's website on their Spark committee. And I will just kind of start out by saying the CARES Act provided fundings to the different states for COVID. And the federal CARES Act funded, well, I don't know if they've received it yet, but $1.25 billion to the state of Kansas. Now, if a county had a population over 500,000, then they received those monies directly. Everything else went to the state for the state to allocate it out. So you'll see Johnson County received $116 million directly. Sedgwick County was $99.6 that they received directly. So that left the $1,034,022,049 that the state has to allocate out. The purpose and the restrictions on this is to address medical and public health needs related to the emergency and to provide economic support to those suffering from employment or business interruptions due to COVID-19. Payments can only be used for the following costs: necessary public health COVID-19 emergency expenses not accounted for in the budget approved as of March 27, 2020, and they must be incurred from March 1st to December 30th of 2020. So these costs all have to be incurred by the end of the year. So we are under a short time frame here. This task force has decided that they will have a 3-round approach to this money. The first round will be a phased approach to improve health and economic outcomes. And now the first round, this money will go to the counties for the county to use. When they looked at well, let me go through this a little bit more if I can get the mouse to work here. Okay, the second round is more for economic development. It's for strategic investments to revitalize the economy on a short-term and a long-term basis. So this second round will be controlled by the state. The third round is really set up in case we have a reemergence of the virus, that they can have money available to use for that purpose. So this is the 3 rounds that I went over. Excuse me. The first round goes to local governments. So it goes to the county, for the county to disperse out. That amount is $400 million, and I will get into that a little more in detail. The second round is slated for August. That will be with public and private entities. And then the third round will be in October, and that will be public and private entities also. So this first round is the round that really affects us directly. The $400 million is what they have allocated for that. That is 39% of the money. So if we go into this first round, if you look at the money that Johnson County and Sedgwick County received directly, and you back that back into the per person dollars based on their population, that was $194 per person. So the committee has kind of looked at if we applied that same $194 per person to the population of the remaining counties, that would total about $350 million. So that is part of that $400,000. The second part is an impact fund. And that will
400,000.
also...
Did you say 400,000 or 400?
400 million,
Okay.
Thank you. Yes, 400 million. So this slide shows the breakdown of that 400 million. 350 million goes to the county based on this $194 per person. The other 50 million of that is an impact fund because not all counties were impacted in the same manner. So they will look at the counties that had higher COVID-19 rates, and they will also look at the counties that had higher unemployment rates. You'll see in the left-hand, or the bottom right-hand corner here, the average COVID rate per counties was 3.3 per 1,000 people. The average unemployment rate was 11% for the state. If you look at our county's numbers, according to their map that they were using, they showed Shawnee County had 1.6 COVID cases per 1,000 people. So we would be under that average. But our unemployment, they were showing as 12.1%. So we would be over the average unemployment rate. So we may get a piece of this 50 million, certainly probably not a large piece, but we could potentially get some of that. Okay, this first round money, they're going to break it down into two categories. One category is on a 50-50 basis. One category is for reimbursements of actual expenses. Then the second category is on direct aid without requiring reimbursements. It gives a list here of COVID expenses that can be included. Now, we don't have specific detail on these, so that's why I didn't want to say definitely what can be covered, because we don't have the guidance yet on these. But what they have listed in broad terms is PPE, testing supplies, contact tracing, and that's why I think that this contract could be included in this, quarantine resources, payroll for employees dedicated to the COVID-19 response, medical expenses, and public health costs. As I said, it's a 50-50 split. 50% will be from reimbursements, 50% from direct aid. And they said that they did set this up as a 50-50 split to give some flexibility to counties. They're also asking for anything that will not be spent by the time of the third round, which is October, that would all need to go back to the state, so then the state could use it in some other way. The CARES Act also encourages the counties to share these funds excuse me, with cities, school districts, local businesses, and they named hospitals, clinics, those types of things would fall in under that local businesses. Okay, so then this is, we look at this, I went over the 350 million, the 50 million, the disbursement, and then here is their schedule. They are to notify us, I believe, I'm hoping they will notify us of the exact amount and of all of the requirements that go along with it. That is to be June 19th. July 10th, it has resolutions. I believe that each county will have to pass a resolution to accept these funds. They would distribute on July 13th. Everyone's plan is due to them on September 15th, and then October 1, anything that they received back that hadn't been spent, they would redistribute that. And there again, December 30th is their deadline. So I have just calculated based on $194 per person. Based on our population, the U.S. Census shows our population on July 1 of 19 as 176,875. So if I take that times the $194, that is $34,313,750. So that is my estimate of that $350 million that we will receive. Now, we may receive a small amount of that impact fund also. But, so we have a big job. We have a big job ahead of us to look at all of our partners, you know, the cities, the school districts, the, you know, hospitals, all of those entities, and how are we going to evaluate how to distribute these funds among all of them. We will be one of the recipients, but then we will need to evaluate who else in our community should also be a recipient. And that's where today's agenda item comes. I am asking that we establish a Spark committee for the county. They would help to decide how much goes to what entities. The well, I say they would help decide because they would vet out all of the requests and then bring recommendations to you. Ultimately, the commission is who will make this decision on what entities receive how much. I've also started working with our IT department on potentially having a portal on our website that entities could use to apply for these funds. You know, all of the cities, the school districts, that type of thing. Sedgwick County has set up something similar to this on their website. I think I sent a link to each one of you so that you could see that. I think this will help us to move quickly, and we obviously have to move quickly on this. Also, if we have a standardized portal that they use and answer the same questions, then I think it will be easier for us to evaluate all the different proposals side by side and on the same kind of common ground kind of thing. You know, that way you're not having a big professional proposal by one entity and a small one by another one. We're really looking at the needs. Sedgwick County right now is doing a needs assessment, but they had already received the money. I don't think we have time to go through a needs assessment and then go through the application process. I think since we have a shorter time frame than they did, that we need to do this as one step. So anyway, that is kind of why I am recommending that you create this Spark committee. And then, then we will get to work. This is a lot of money. It can affect a lot of entities in our community, and want to make sure that we can use absolutely all of it. So.
I've heard that we can't use this money to compensate for lost revenue due to COVID.
And that is my understanding too, that lost revenue is not eligible. But until I get some specific...
We have no guidelines yet?
No, we have no guidelines yet. And I will say emergency management has been working on trying to get more information. I've been working to try to get more information. This is about as detailed as we have right now.
You think the guidelines will be similar to Sedgwick County and Johnson County? Possibly.
Yeah, I would certainly think so. It's all coming from the CARES Act, so I would certainly think so. Now, those two counties could potentially receive a piece of that impact money because they've already received the $194 per person, but they would also be eligible for that impact money based on their cases and their unemployment. I have given you a list of committee members that I would recommend, but this is just a recommendation for you to open up the discussion on whether you do want a committee and who you want on that committee. I will say I do feel strongly that the committee should be made up of, it should not have anyone on the committee that would be receiving funds. I think that would be a conflict of interest. So I think, we have to be careful of who's on the committee because some of these people will be applying for funds.
Okay. So we need to make a motion to form a Sparks committee. I guess I'll make that motion.
I'll second, but I do have a question.
Oh, go ahead.
Betty, you said not to have anybody on the committee that would be receiving.
Mm-hmm.
But we have county representation on the committee.
Right,
and
but the
county
money
would be applying.
Yes, the money is coming to us, and we are encouraged to share it. We are not required to share it. We are encouraged to share it. So how I see this working is that first, since we have the health department and that at the county level, we look at our expenses for this first and determine how much of this money we need to allocate to us based on our expenses, and then that gives us the remainder amount to look at sharing with other entities.
So out of the $34 million, if we set up a portal on the Shawnee County website, every entity that is impacted would be able to apply and complete a grant application for either direct aid or reimbursement?
Well, and that's how I'm envisioning it. Now, once we get a committee, then I guess the committee would decide that. That is the way I'm envisioning it working, because I think that will help us to move quickly on this. But yes, each entity, then we would have to look at those and make sure that what they are applying for are eligible expenses.
Now, we're not setting up this proposal is not to set up a formula that says 25% goes to hospitals, 25% goes to the county, 25% to the city, 25% to everybody else. This is going to be based on your actual reimbursement or direct aid.
Well, I think the committee will have to look at these applications and then, set some criteria on what they're going to use to evaluate them.
And so we may have everything from a $15,000 reimbursement in the treasurer's office to $120,000 reimbursement for contract tracing. Just using those as two
And that's just
examples.
within the county. Then, say a school district could apply, or the city of Topeka could apply, and, based through this portal of what their needs would be.
And then is there not a recommendation to a specific commissioner? The chair would either designate or appoint.
As we know, because of statute, only one of you would be able to be on the committee. I am recommending there be one commissioner on the committee. But there again, this is a recommendation. It's up to you to take whatever action you see fit.
I think there should be a commissioner on the committee.
We don't have any guidelines on who's eligible yet either, do we?
No, we don't. Well, very broad, but no.
Also, I wanted to ask you, how large a committee are you looking at?
Well, this, let's see, I think I had 9 voting members. And then I was also suggesting one person at the table from Greater Topeka Partnership that would be a non-voting member. And they would be like an ex officio member because of our relationship with them from JADO.
Would they be eligible for funding? We don't know.
I don't know. I don't know.
Okay.
But like I say, you can change this list in any way you would like. This was just a starting point for you.
Okay.
I do think we need an odd number of voting members.
All committees should be an odd number, and 3's too many. No. No. No, that sounds like a manageable number. So.
I don't think you want any larger than that, or it'll be hard, again, to get people together, to get consensus.
All right. Did you have any questions?
No, but public comment.
We do have public comment.
Oh, okay, I'm sorry, I didn't see you there, Terry. Go ahead.
This is a bonus day for me. Terry Roberts, registered nurse. So come on the right day. This happened one time before. Thank you, Betty. That was a great overview. This CARES money is going to be incredibly controversial, just so you know, okay? There's going to be a lot of controversy related to this. So who gets it, how it's dispersed. There's one thing, I always like her level of detail. There is one thing, though, that I kind of disagree with her on, and that is a needs assessment. Okay, it is 2020. We do have electronic transmission. And at the very least, we should look at Sedgwick County's needs assessment to see what they actually analyzed. What did they do the needs on, okay? What did they identify? So, of course, I'm a nurse, and we look at assessment is important to us. So I think even a modified needs assessment would be essential for you to identify where the expenses are, where the need was, and how, the things that can be reimbursed are how they were used or obtained or not obtained. We're still having some problems in nursing homes throughout the state getting some of their stuff. But I do think a modified needs assessment. She's right, the time frame is small. And there's another thing, okay? The federal government, related to the whole rolling out, okay? Look at the PPP changes, okay? It's going to change, okay? So what they tell you tomorrow or next week is probably going to be a little bit modified. So I just wanted to warn you that that journey continues. And healthcare professionals, we've been experiencing this throughout, it's day by day, okay? on who you can test, what the criteria are for testing, how we're going to disinfect PPE. I mean, this is just part of the journey of a pandemic that we were unprepared for in our country, okay, to this degree, okay? We thought it would be bacterial. It is not, okay? And so we're struggling. And the plan isn't due till September 15th. That's also a short time frame. That's less than 90 days, okay? And that's a huge plan for you to have to identify. So good luck, whoever you appoint to that. I wish them well, but I think looking at what other people have done in terms of needs assessments is not a bad idea as a starting point. Thank you.
Thank you. All right.
I'll just add that I believe Betty's already sort of started working on that type of thing. Today, we're just talking about the committee itself, right?
Yes.
That's right.
Yes, and the committee will then go through all these and determine the steps, the criteria, all of that.
Again, I'm in favor of the committee. Mr. Chairman, do you have any thoughts on who should serve from the county as the designee?
I do not. Do I have a volunteer?
Mr. Chairman, if you want to volunteer, I think that Commissioner Mays was pointing your way.
I can do it, but,
All
all right. We have a motion on the table to create a Sparks Committee. Motion was made by Commissioner Rippon, second by Commissioner Cook. All in favor, say aye. Oh, we got another.
I just have a question. Is that establishing it with the people that I had listed on my memo, or?
Yes.
Okay.
Yes. All in favor, say aye.
Aye.
Those opposed, motion carries 3-0. Thank you, Betty.
Thank you.
Were you going to have a motion for who is going to be the representative from the commission, or
I
is
thought
that?
that was
I thought that was part of the
Should-
motion.
That was part of your motion? Okay.
Yes.
Because there's no commissioner listed on the.
Okay.
memo, so
And
to
designated.
include- Okay.
Yeah.
All right. Next item.
Item H, commission, number one, acknowledges that Commissioner Mays is appointing Jeanette Johnson to the Shawnee County Planning Commission beginning July 1, 2020.
Commissioners, I was notified about a month ago that Elaine Schwartz is resigning from the Planning Commission to spend more time with her grandkids and other interests that she has in Shawnee County. And so I went through kind of a process of finding someone, and Jeanette Johnson is a realtor in Shawnee County. She's won multiple awards. She's been doing this for decades, and I think it'll be a good addition to the Planning Commission, so I'd like to move for her appointment.
Second.
Motion's been made by Commissioner May, seconded by Commissioner Cook. All in favor, say aye. Those opposed, motion carries 3-0. Thank you. Next item.
Item 5, administrative communications.
Okay, at this time, we'll allow anybody from the public to speak or from our different departments.
Good morning, Commissioners. Randy Luby, Parks and Recreation. I just want to let you know, all the pools and aquatic centers, with the exception of Rossville, will be open on Monday. That is still with the restrictions that we'll find out here in a little bit if everything goes well. Did want to give you a brief update on Rossville Pool. We did find the leak. I saw the pipe brought in today, and it had a hole about the size of a quarter and cracked. So obviously we're on the right track there. Also, I want to thank HR. I know it's been difficult trying to get guards. We do have enough guards to open the pools, but if we lose a few, that could change down the road. So, but anyway, I just want to update you on that, and hopefully Monday we'll be able to swim.
I heard where K-State, KU, I don't know about Washburn, they're going to start earlier this year. Is that going to affect our lifeguard situation?
It very well could. Generally, we close after the second weekend of August, and we keep one facility, one of the big aquatic centers, open through up to Labor Day. We'll just have to play it by ear to find that out, but that's a good point.
A wild year. Okay, thank you.
Thank you.
Anyone else? Really?
I think Aaron's coming.
Oh, Aaron, there he is.
Good morning, Commissioners. Aaron Mahan, Shawnee County Emergency Management. It seems the last 2 to 3 times I've gotten up here and asked people to be prepared for severe weather, it just kind of sprinkled a little bit, and that was it. But I'm going to be happy to say this time that it's going to rain, hopefully. I will add hopefully. That's what they're forecasting, at least. Hopefully, we'll cool off the hot weather we've been having. However, with the dry ground, if we do get a lot of rain at one time, we could potentially be looking at some street flooding or minor flooding. So once again, if you would just be prepared for that, have your travel plans ready. If you do have to go out and about, watch for those flooding areas. And once again, turn around, don't drown. Have your emergency preparedness kits ready. They are saying there is some potential for some severe weather. However, they've limited that to very heavy rains and some high winds. So be prepared for that as well. Thank you.
Thank you, Aaron. Thank you.
Good morning, Commissioners. Craig Barnes. 2 updates today from the Health Department. The one being, first, we are going to be moving our drive-through testing starting next week on Tuesday. We've had a great partnership so far with USD 501 at the Highland Park High School. We will be continuing to keep our drive-through testing in that 05 zip code. We're going to be moving just a mere 10 blocks away to New Mount Zion Baptist Church. So we want to specifically first thank 501 for the partnership that we've had in this first period for the drive-through testing, and then thank New Mount Zion for allowing us to use their facility moving forward. Our nurses have been out there in the heat. We've already had one move to the morning. Our nurses are out there in full PPE gowns. As Commissioner May said last week, the Tyvek suits do look like spacesuits out there. So it can get a little warm and toasty out there with the face shields and masks and everything. So we're moving to a little bit more area that can give us a little bit more shade and hopefully get a cooler environment for our nurses and make it a little bit easier as well. It's a great site, still allow us to do a good facility and good traffic flow through there. Times will still continue to stay at that 8 to 11 on Tuesdays and Thursdays, but we'll be at New Mount Zion starting next Tuesday. So we wanted to wait until we were in full swing of our testing today so that we did not have any confusion for those who had already signed up for our testing today. So, all right, so that's my first announcement. The second announcement gives me a lot of joy and excitement as an employee. Often you don't get the opportunity to recognize your boss as much, right? Usually they're the ones doing the recognition of their staff. But I did want to point out that as of Monday this week, I guess I should show the magazine first. Ingram's magazine comes out, Kansas City Business Magazine comes out with a edition each year that is 50 Kansans You Should Know. And so this year, as part of that, our director, Linda Oakes, was recognized as one of the 50 individuals in Kansas that you should know. So on page 52, she's got a nice little biography there. She was one of a handful of individuals from the Topeka, Shawnee County area. I think that's not only a testament to our community that we had multiple members here from Topeka and Shawnee County, but also in the middle of a pandemic, to have the health department director being recognized by a business magazine for the work that she's doing is a testament not only to what Linda has been doing. She'll be the first person to tell you that it's the team effort, but without the guidance and the leadership from Linda, I don't know that the health department or our community would be where we are today. So I just wanted to take an opportunity to recognize her. She does so much to recognize her staff and our community partners, and so I thought it very important to make sure that she got the recognition that was due to her for the great work that she's been doing here in our community. So.
Speech?
No.
That's all I have. Thank you, Commissioners. I appreciate it.
On your testing, are you finding many cases?
So Dr. Pizzino will have a slide. We created a slide specifically anticipating that question. So I'm glad that our great minds think alike there, Commissioner Rippon. So we will have a slide specifically for that in the Board of Health that will show our percentages for the testing through our drive-through.
Thank you.
Yep.
Linda, this is quite an honor. Congratulations, and it's well-deserved. She is very, very committed to her job and the health of Shawnee County, and is the first to defend her staff and to worry about her staff, their well-being, and I certainly appreciate that. So very good, Linda. All right.
morning, Commissioners. Angela Lewis with Human Resources. Randy just asked me how I was going to follow that. There's no way to. I'm proud to know Linda. Congratulations. Secondly, Shawnee County is hiring. I want to remind everyone at the county and everyone in the public that, you know, we've gone through this pandemic. We've found that our employees and our departments are very agile and have done everything that they needed to do to help us work through this, because it's a continual work through. But we are hiring and we need people, specifically in the DOC, Parks and Recs, and plenty of other departments. So feel free to visit our website, www.snco.us/jobs. Thank you.
Thank you very much. Anyone else? Commissioner Cook?
There's a lot going on this weekend, but be weather aware and hope everybody's safe.
Good. Commissioner Mays?
Nothing for me.
I have nothing else to add to that. What is next here?
Well, I think Happy Father's Day to all three of the board commissioners is appropriate.
I think we all qualify.
I mean, it was always tough to do that when Commissioner Bueller was on the board, but, you know, I can do that now.
Well, thank you. Yeah.
Item 6, executive session.
We do have a need. I'd like to make a motion to go into executive session for a period not to exceed 30 minutes to discuss personnel matters not of non-elected personnel, specifically to discuss compensation of classified and unclassified personnel. I would like to ask our Human Resource Director, Angela Lewis, to attend executive session. No action is expected to be taken.
Mr. Chairman, can we add Betty Griner from Audit Finance as well?
We can. All right.
I'll second your motion.
Motion's been made by Commissioner Rippon, seconded by Commissioner Cook. All in favor, say aye. Those opposed, motion carries 3-0. Let's see, we are also going to have a Shawnee County Board of Health meeting. Let's see, we'll go into executive session, so it'll start around
11 o'clock.
11 o'clock. Does that sound good? All right. All right. We are now in executive session.
Well, you still have like a minute, but I thought, well, this way we get this.
We can go ahead and
Okay,
end
sure.
this one.
Yep.
You ready?
You
Okay.
go ahead and cancel, go close the meeting out and we'll go
Yes.
adjourn the meeting and then we'll go forward.
We're back in session and we're now adjourned. No action taken at this time.